got a lacrosse ball low back release here. Basically using the lacrosse ball, we want to get in and just release a little bit of pressure along either side of the low back muscles, being pretty gentle, pretty careful with that. So anytime we're releasing in around the spine, we have to be pretty careful that we don't irritate anything in there, because basically if you have some spots that are sort of sharp feeling, that's already a little bit irritated, and add an additional pressure to it isn't going to help you any. So what you want to do is you want to be able to kind of check between the two sides and see what just kind of feels like dull, achy, stiff, and target that. So with the ball, we're going to be kind of like right in this area in the low back, right above the crest of the pelvis. We're going to drop off to one side, we're going to come back to center, drop off to the other side, and just sort of do a little bit of assessment to figure out how that area is feeling before we start to target it with the ball. So when I come down, I'll find out where center is, drop off a little bit. Now, at that point, that might be enough pressure. If you need a little more pressure, you can bring your knee up towards your chest. Maybe take a deep breath there, see how that feels. Shift back to center, and then just a little bit off to the side. Bring the other knee up, take a deep breath. And see how that feels. So you're trying to learn to figure out, like, what is he talking about when he says that feels a little bit sharper on one side, and trying to be sensitive to that. If the longer that you sit on it, or the more that you kind of pull in, the worse it feels, and it kind of makes you feel like almost like it's just getting sharper, or it's getting a little more irritable, or it's not releasing pressure, it's not helping you out, right? You need to kind of switch that up and either try the other side, or this technique may just not be appropriate for you, and you need to go for something more specific, like working with an actual professional who's going to get their thumbs in there, or going to set you up in some really specific positions, or possibly do some other techniques like dry needling, which will be less harmful to your tissues. Okay, so that's something to try, but a lot of caution around rolling techniques around the spine, because you don't want to piss off your nervous system. That's not really good for you. All right, so thanks a lot and good luck.